Welcome, Excellencies, distinguished panelists, colleagues, and partners. Good afternoon from Bangkok, Thailand, and thank you for joining us today for this exciting discussion on being better prepared, pandemics and disaster risk reduction. The purpose of our time together today is to discuss lessons learned from the Asia-Pacific region and the current project mapping of ASEAN and member states, laws and policies related to the COVID-19 response, and how we can develop ASEAN guidelines for public health emergency legislation. My name is Ranjini Raman, and I am the Senior Protection, Gender and Inclusion Officer for the International Federation of Red Cross and Red Crescent Societies, the IFRC. I have the pleasure of introducing our esteemed colleagues who are presenting today and guiding us through today's panel, which will take place over the next 1 hour and will include key voices in the region working on public health and emergencies. Before I introduce our hosts for this event, I would like to share a bit of housekeeping information. So a bit of a challenge today, we'll be keeping to time. So each of our panelists will have approximately 5 minutes each, and we will aim to have around 10 minutes at the end of the discussion for questions. All participants' mics have been muted and cameras are switched off. So if you have any questions throughout the session, please share them into the Zoom Q&A box at any time, and we will do our best to address them at the end of the panel. This webinar will be recorded and it will be uploaded. So the recording will be shared with all registrants as well. To begin, I would like to introduce the host of this event, Ms. Catherine Clarkson. Catherine Clarkson is the head of delegation for the International Federation of Red Cross and Red Crescent Societies Country Cluster Delegation for Thailand, Cambodia, Laos, and Vietnam. And she will officially open this panel. So thanks for being here, Catherine, and over to you.
Thank you, Ranjini. Excellencies, distinguished panelists, ladies and gentlemen, it's really my honor and privilege to welcome you to this side event hosted by the International Federation of Red Cross and Red Crescent Societies, IFRC, in partnership with the Ministry of Foreign Affairs of the Kingdom of Thailand. As our region starts to recover from the widespread health and socioeconomic effects of the COVID-19 pandemic, people's coping capacities for dealing with new disasters and crises will be stretched. We need to learn from lessons from COVID-19 and be better able to support the most vulnerable people to deal with the impact of complex disasters. We may not have known the full extent of what was to come with the COVID-19 pandemic, but we could have been better prepared. If the COVID-19 pandemic has taught us anything, it is the importance of being ready and the central role of law and policy in combating public health emergencies and in protecting communities. Our extensive research, including recently in collaboration with the ASEAN Secretariat, has shown that in many cases, states were not legally prepared to manage public health emergencies. Laws, policies, contingency plans were often outdated or inadequate. Furthermore, public health emergencies were and still are often regulated separately from other emergencies, even though the response to them is rather similar. Law and policy play a critical role, enabling states of emergency to be declared, lockdowns to be imposed, determine who can lead, act and fulfill specific roles, and the expedition of vaccine approvals and their administration. We need to integrate law and policy on public health emergencies with general disaster and emergency laws and policies. Avoid a siloed approach and eliminate gaps, conflicts and duplications. Make systems more effective and efficient. The Sendai Framework's Bangkok principles also call for cooperation, integration and coherence between disaster and health risk management. The importance of this integration is further highlighted by the commitment from the WHO and world leaders earlier this year for an international treaty on pandemic prevention and response. We need to act while the COVID-19 pandemic is still fresh and put the legal conditions in place to prepare for the next public health emergency, possibly the next pandemic. Today, a distinguished panel of humanitarian and public health experts from across Asia Pacific will share their experience of building back better and enhancing preparedness for future pandemics by looking at how public health and disaster laws and institutions can work together. The floor will also be open to all attending delegates and participants to engage in an interactive question and answer session at the conclusion of the panel. I would like to thank you and SCAP for the opportunity to host this event as part of the 78th session of the Commission. And let me conclude by thanking the Ministry of Foreign Affairs of the Kingdom of Thailand and SCAP, as well as all of the stakeholders present here today, for your partnership in our joint efforts to build resilience against the multiple risks we face and leave no one behind in our efforts. Thank you.
Thank you, Catherine, for those really inspiring opening remarks. Next, I would like to share a video of opening remarks from our co-host for this event, the Ministry of Foreign Affairs, Thailand. These remarks will be shared by Mrs. Eksiri Pintaruchi, the Director General for the Department of International Organization for the Government of Thailand.
Ms. Kathleen Crescent, Head of IFRC, Country Cluster Delegation for Cambodia, Laos, PDR, Thailand, and Vietnam, distinguished panelists and participants. It is my honor and pleasure to welcome you to this event, co-organized by the Ministry of Foreign Affairs of Thailand and the IFRC under the theme Being Better Prepared, Pandemics and Disaster Risk Reduction. The COVID-19 pandemic has become a global challenge that has severely affected our societies, economies, and way of lives. If anything, we have learned that tackling this crisis requires a whole of government and society approach. Resources have been pulled together to find the treatment and vaccines to keep the pandemic under control, as the world is gradually returned to the next normal. Next normals also entailed more preparedness and resilience of peoples and communities. Not only should we draw on international instruments such as the WHO International Health Regulations and Health Emergencies and Disaster Risk Management, as well as the Sendai Framework for Disaster Risk Reduction and its Bangkok Principles, as we have done so far in response to the crisis. But we need to build on them so as to have a wealth of integrated and cross-cutting knowledge and tools that can be adapted to future disasters and wide-scale crises. Indeed, the disparities within and among countries in addressing the pandemic are evident. This is compounded by various complex factors with cascading effects. According to the 2021 Asia-Pacific Disaster Report, the intersection between biological and other natural hazards remains poorly explored and understood. Governments still generally treat various types of emergencies separately, thereby creating silos and gaps in addressing them. As we move along the path towards recovery, it is time for us to reflect on what we have learned from our COVID-19 responses, how we can enhance harmonization of public health and disaster laws and institutions, and whether the existing frameworks mentioned have translated to effective implementations on the ground. I hope today's event will provide opportunities for health and disaster risk reduction experts to share their stories on their COVID-19 response measures, which can and also serve as food for thought on how we may better improve our health-related disaster preparedness, whether through the current negotiations on the pandemic treaties or better synergies between the public health and disaster risk reduction communities. Since 2007, the WHO has warned us that diseases are emerging at a historically unprecedented rate of 1 per year. We have faced the outbreak of SARS, swine flu, MERS, and just to name a few. While their impacts have not reached global scale like COVID-19, it is likely that COVID-19 will not be the last global outbreak. To improve resilience for us and for future generations, we have no choice but to step up and be better prepared. In closing, let me thank the IFRC for co-organizing this event. We hope all participants would leave with added impetus to create a safer world. I thank you.
Our first panelist is Dr. Sanjay K Srivastava. He is the Chief of Disaster Risk Reduction at the United Nations Economic and Social Commission for Asia and the Pacific. It's an honor to have you here with us, Dr. Srivastava, and the virtual floor is yours.
Hello. Thank you, colleagues, and thank you, IFRC, for giving this opportunity to UNESCAP. I had 2 points to highlight as requested by our colleagues from IFRC. One is the important step to take forward the joint approach of law, policies, and action, and what progress we made in ISCAP in this direction. So as I'm so happy that IFRC has been leader on this front to bring together the policies, strategy, and law. You know, when you look at disaster risk management framework, which most of the country have adopted after the Sendai, which are mostly aligned with the Sendai, there is a lot of disconnect between policies, a strategy, and then there is not much legal binding or legal backup. So disconnect between policy, a strategy, and the legal and the law leads to some kind of disjointed action on the ground. So actions on ground are siloed, disjointed, and as rightly said, not been very effective. So this is very important to have all in a perfect symphony, policy, strategy, and law. And that's where the contribution of IFRC has been great in the region. And this is something which a agenda of policy coherence, which we need to take it forward in coming days. And this will be a great contribution, particularly for bringing disaster risk reduction and public health emergency together. Then comes to what we did from ISCAP side on this perspective. You know, UNESCAP is a regional economic commission of United Nations. So our focus was start from analytical work, then build cooperation among the countries, build capacity of the countries. So we started with our analytical work in this area of bringing law, policies, strategies together. One of the missing link was there were no analytical solid background for bringing this coherence. So what we did in UNESCAP is we brought out Asia Pacific Disaster Report 2021, and this was one of the few reports at that point of time in the midst of the pandemic, which could able to see the intersection of disaster with health. So in the process, because we have to make an economic case to the government, the policymakers. So the Asia Pacific Disaster Report, the first thing that came was, what is the aggregate losses if you take disaster, the climate extremes, and health together? So the best that we could able to do within our mandate was you quantified the economic losses, one due to the disaster, climate extremes, and also the public health emergency associated with the disaster event. I would like to quote these numbers that if you look at what is the annualized average losses in the region from disaster and health related issues. So this is 780 billion per annum. This is a huge loss if you look at from the Asia Pacific overall economy, the regional GDP point of view. But in 780 billion, the contribution to health related disasters is $105 billion, which is 13% of the total losses. This is quite significant. Health related losses were never accounted for while accounting for overall the losses due to the disaster risk reduction. We do many of the post-disaster needs assessment. The assessment of the health sector has not been something very concrete for government to act upon this. So this was a first message that came out, that disaster and associated health will have a huge impact in addition to the public health, also all the economy. So it helped to build the economic case of the public health. So what we have done, if you look at the Asia Pacific Disaster Report, we have put a disaster database where health and disaster all are together. So if a public policy has to be taken into account, where disaster and health both at one platform, one data set, a risk profile which comprises health, climate, and disaster, you will get this information. Thank you very much. I'm here for any other question coming back.
Thank you, Dr. Srivastava, for your remarks. I think it's really important to hear that reiteration of working together, and thank you for your kind words to IFRC on this topic. So I'd like to turn it over now to our next speaker, Dr. Genevieve House. She is the coordinator of the Health Law and Ethics team in the World Health Organization Western Pacific Region Regional Office. So glad to have your expertise today, Dr. House. I pass the mic to you.
Thank you so much, and I want to thank you and the IFRC for having me today and for organising this this very important event. So WHO is working across our member states to strengthen their legal frameworks for health, and we're noticing a lot of interest post-COVID-19 in legislation that might support a response to health emergencies and health systems and health services. So how might we be harnessing those lessons learned? Our region is so diverse. No country began the COVID-19 pandemic with the same law or used their laws in the same way. So I just want to touch on the broad themes that we noticed as the COVID-19 emergency emerged and then was declared as a public health emergency of international concern, and as different countries tried to address it. So first of all, one of the things that we saw was the basic public health function of surveillance, which is basic public health practice, the ability to detect, test, isolate and treat every case and to trace and quarantine contacts based on public health advice. Most countries had some laws that supported this kind of activity. Then there was restricting movement, COVID-19, highly infectious, and of course some variants even more so. So to mitigate or prevent transmission, many laws enabled imposition of rules with which we're now so familiar, that restricted free movement of people and their use of public spaces. Most countries use laws to impose measures to manage the public health risk at points of entry. Very important, restricting entry, seeking information from arrivals, requiring testing and the imposition of quarantine. Some countries use laws to support collection, reporting and use of health information and data, and then use that on which to base their decisions, which might be restricting entry, seeking information, and so on. They also impose requirements for protection and privacy information based on human rights principles. Many countries observed an increased need for medical equipment and supplies, so laws were used to help address this. For example, prescription extensions that encourage people to stay at home, alteration of statutory requirements about procurement to allow swift emergency procurement of necessary drugs and medical supplies. There were emergency laws to restrict broad availability of some drugs, and that was to try to manage availability for the emergency. And legislation also could enable telehealth and other uses of technology. There were emergency, temporary or full-on registration of health workers to increase the workforce to enable a sufficient workforce to address the emergency. Some provided for limited expansion of scope of practice for some health workers to enable task sharing between cohorts of practitioners, for example, from medical practitioners to nurses, to allow vaccination or other types of important activities to address the pandemic. Some countries' laws were used to involve the private sector, again, very important in emergency response efforts. So that might be to increase available system capacity, including available hospital and health facilities and services, such as laboratories. And this was done quite differently across different countries. A few examples include by contracting, by emergency order, or by use of tax incentives. Laws were used to protect human rights and to protect those disproportionately affected by the health measures, of which, again, there were many. Many countries in our region have ratified international human rights conventions and have a legal obligation, therefore, to give them effect. A lot of countries have also given those effect in their constitutions, and their health laws and emergency response laws, of course, are interpreted subject to those. Then ensuring the availability of accurate and reliable information was incredibly important. We saw a lot of disinformation during COVID-19, and that continues. Some countries conferred responsibility via statute or administrative means, perhaps on a senior official to be the only one to communicate with the public. But in an age of swift transmission of information via social media or other informal means, it's a really complex exercise to communicate clearly and effectively. Some countries actually designated the spread of false information as a criminal offence. Some laws were used to attempt to ease the financial burden of the COVID-19 crisis, which might be in the form of, say, mandating payments for workers who couldn't attend work, or rent relief or other kinds of benefits. Laws were also used to safeguard the rule of law during COVID-19. So, for example, to allow parliaments to sit, perhaps the standing orders didn't actually allow parliaments to sit remotely, so they needed to be altered, or for courts to sit, again, remotely. So all of these are worthwhile areas for countries to consider as they now think about their legal frameworks and ask themselves whether they're fit for purpose. And we're getting inquiries on a lot of different areas from different countries, depending on their own experience and what they thought about their own laws. So I suppose when countries are looking at laws, some of the things we might ask them, or they might ask themselves, were, did the laws enable an immediate response to low-level health risk and then enable that to escalate as the response to the risk also escalated? Did they enable an aligned response across affected sectors and government levels? And was it always clear who was in charge? We heard a lot of reports that there was a lot of confusion about who had certain powers to do certain things. So if asking these kinds of questions elicits doubt in the effectiveness of the laws, then we'd suggest it might be good to have a review. We also note that there's some interesting things about the current time. The health sector doesn't always enjoy the kind of multi-sectoral support necessary for a legislative reform to be supported at, say, cabinet level or whatever the high level decision-making body might be that sponsors reforms. But during COVID, we'd suggest an important lesson was learned by many non-health sectors: finance, customs, police, aviation, agriculture, justice. There were many. And the lesson was health matters. We really do need to pay attention to the management of our health system and the health of our population at risk to our community, but also to our economic advancement. So we'd suggest a rare window of opportunity has actually opened, although it will, of course, close. So we suggest that if review and reform is needed, then a very good time to do that is now. And that was really the comment that I would like to make to you all, and thank you again for the opportunity to present.
So next, I would like to introduce Dr. Alisa Yanason. She is the medical physician within the Division of Public Health Emergency Management for the Government of Thailand. So thank you so much for being here with us today, Dr. Yanason, and we really look forward to hearing your thoughts.
We divided the outbreak situation into 5 phases. The first one was the phase whether the pandemic was at the overseas. So the key event was the risk of the returnee to cause the local transmission. There's the risk of the news and social media that might cause the anxiety and panic in our society. So what we did activate our EOC, prepare the flight for Thai returnees from China and other countries. The next phase is the first report. Our first cluster started from the boxing stadium and the nightclub, which caused the local transmission to all over the region of the country. At that time, there were the price raising of the PPE hand sanitizer. That time we did activate the CCSA, which is the Center for COVID Situation Administration, chaired by the Prime Minister and Secretariat by the National Security Council. In the next phase, we call this the dormant phase, which was the time that we could suppress the number of the new case below 20 for a few months. That time we did lockdown, we did quarantine for all, and we worked closely with the Ministry of Defense, Royal Thai Police, and the Ministry of Interior. In the phase 4, it's the new wave of the infection. The pandemic was continued spreading all over the world, and we did have the largest cluster of the country from the wholesale seafood market. We had a lot of more than 300,000 illegal workers across the national border. We have Thai labor travel back to their home, which caused the nationwide transmission. That time there were shortage of everything, so we utilized the field hospital, telemedicine, home isolation, and of course we had a great help from the public and private coordination. And the last phase was the Omicron and the post-pandemic. We still have the COVID-19 ongoing, but the vaccine has arrived. So what we do now is we run the communication strategy on hope. We call it the Hope Campaign to help our citizens to move on to the normal life after the pandemic. So what we have for good practice, we think that quarantine facilities, whole society approach, risk communication, vaccine for the vulnerable group as the priority, and the village health volunteer are the key elements for managing the public health emergencies. This is the last topic that I will talk in my presentation. This is our risk map. That we do have a lot of risk for disaster. We have flood, landslide, drought, earthquake. And on the right-hand side is the health facility at risk of all over the country. So we do have to prepare our health worker and our frontline worker for the response. So in order to be better prepared for the next emergency, our goal is to have the national security of the health system in crisis. We want to strengthen our medical hub. We want the whole society to play roles in emergency response, and we want it to be sustained. So in each phase of disaster, there are a lot of activity to be done. In preparedness, we need some network, we need education training, financial, preparing, strengthening the coordination. In terms of mitigation, we need risk reduction, we need risk assessment, risk management. In terms of detection and response, in order to have a timely response, we need a strong and unified incident command system, whole society approach, risk comm, and utilization of technology. In recovery, we resilience, we want to build back better. We have to take care of our mental health, environmental health, and infrastructure. So what we learned so far is that health sector alone is not enough to save the lives of our people. We need the whole society to join, and public education and health literacy for self-care during crisis is very important when the resource is not enough. And risk assessment and risk management are key steps to support the decision-making of the incident commander. And lastly, to integrate the Bangkok principle with the national strategic planning will enhance the preparedness of the future health emergency. Virginie, may I turn the floor to you.
Yes, thank you so much, Dr. Yanason. That was such a great presentation, and it was really insightful to hear about the government of Thailand's response. And I think these good practices are definitely important for future actions and responding to possible future pandemics. And I also really liked what you said about self-care and how important that is. So I would like to now pass it on to last but not least, a dear member of the Red Cross and Red Crescent movement, who's here with us today, Mrs. Tautala Ma'aula. She is the Secretary General of the Samoa Red Cross Society. It's really lovely to have you here with us, Ms. Tala, and I would like to hand it over to you now.
Thank you very much. Talofa to you all. I'd like to speak on two questions that were given to me to talk about. One is how the role of Samoa Red Cross Society has been legally recognized and how this has enabled it to perform its roles as first responder during the COVID-19 pandemic. Well, I believe everyone, especially with the Red Cross, the Federation, Red Cross, Red Crescent people around the table, understanding how we had come about. Samoa Red Cross is one of the 192 members, National Society of the International Red Cross, Red Crescent movement is equally sharing a specific mandate to support its public authorities. This is in the case of Samoa, the government of Samoa, in the humanitarian work. And before the Samoa National Red Cross Society became part of the movement, a number of conditions was needed to be met. First was the government of Samoa must have agreed to be bound by the Geneva Conventions of 1949. Then the government must legally recognize the National Society in some form of domestic law. Another condition was that the National Society acts as an auxiliary to the public authorities in the humanitarian field, and much more. And these developments spoke volume during the early inception of the Samoa Red Cross Society through an act of parliament of the independent state of Samoa as its auxiliary partner in the humanitarian field, which is of course at the core of our identity. The auxiliary partnership between the government of Samoa and Samoa Red Cross Society is a unique and defining feature which distinguishes the National Society from all other organizations in the country. And this auxiliary partnership reaffirms the Samoa Red Cross autonomous status to negotiate with government clearly defined roles and responsibilities in providing risk reduction and disaster management activities, health and social programs, the promotion of international humanitarian law and the international disaster response law and humanitarian values. Well, of course, this simply means that both parties, government and Red Cross, have obligations with each other through a balanced relationship with reciprocal responsibilities and mutual benefits, which are in addition to the statutes of the movement, the government of Samoa enacting domestic laws pertaining to the auxiliary role of the Samoa Red Cross Society in the humanitarian field, as stipulated in several acts. We have the Samoa Red Cross Act, we have the Occupational Safety Health Act, the Ministry of Health Act, the Disaster and Emergency Management Act, and the Geneva Convention Act, which is further to the legal base of the Samoa Red Cross Society, which also includes sectorial mandates through national policies, plans, memorandum of understandings and agreements, which have similar provisions of its consolidated roles and responsibilities in disaster risk management, which of course includes disaster preparedness in peacetime, disaster response in emergency and disasters, the actions that went on to disaster recovery, rehabilitation, and mitigation, which have been and are similarly practiced since the onset of the COVID-19 pandemic in the early 2020s to date. when it has finally reached our communities and enabling Samoa Red Cross Society to continue to respond more effectively in accordance with its mandated roles as first responder to the impact of the COVID-19 pandemic affecting our Samoan community. The other question that was given to me was, as an organization working across the health and disaster risk management sectors in Samoa, how did the Samoa Red Cross view the coordination between the government agencies? What worked well and what could be done better next time? Samoa has a strong and well-functioning disaster risk management infrastructure, framework, and operating systems led by members of our government, the cabinet, with our Honorable Prime Minister as chair as the National Disaster Council, whose responsibilities and powers are to review, approve, and endorse where appropriate any recommendations or advice given by the Disaster Advisory Committee. And the Disaster Advisory Committee is made up of all heads of government ministries, the organizations such as the Samoa Red Cross, which make up this committee and whose main role is to assess and review any approaching disaster or emergency to expedite the giving of advice to the National Disaster Council, which is cabinet, and timely implementation of the National Disaster Management Plan. So when a declaration of a disaster for this case, the COVID-19 pandemic, was done by His Honorable Head of State, the National Disaster Management Plan and all sectors and agencies' disaster response plans are immediately activated, as well as the National Emergency Operating Center Office, which coordinates the entire national operation as we are now experiencing with the COVID-19 pandemic situation in Samoa. However, having a strong disaster risk management infrastructure in place also has potential to cause hiccups and create challenges in a perfect system. And we have experienced that during the ongoing state of emergency period since March 2020 in Samoa, we have noticed a huge drop in numbers of our valuable human resources as they transition interchangeably through our able population of young men and women whom we have trained in the disaster risk management system in the communities, having migrated overseas through some regional seasonal workers program with our big sisters, New Zealand and Australia. We also have a great loss of several of our disaster risk management oriented and experienced heads of ministries whom have left the services when their contracts ended, as well as our country transitioning from the old government to a new one during the state of emergency for the COVID-19 situation that have also changed the membership of the National Disaster Council. We have medical staff, nurses, doctors, lab scientists, and them that have contracted the virus, affecting their vital work commitments. Our National Disaster Management Office posts have been vacant for a long time, and the pressure of the coordinated work has been handled by new recruited staff, requiring the national coordination role to be further strengthened. But with the combined support of all the representing members of the various 14 sectors of government and responding agencies who have operated our disaster risk management system to where we are now, while compacting the impacts of COVID-19 widespread into our vulnerable community. Last but not least, the importance of having a more effective national disaster risk management system must be reconsidered, being legally prepared for international assistance regarding arrival of relief consignment to assist in the response effort. But it continues to be a burden in delaying response reach to those in desperate need and suffering from the impacts of disasters, especially in the current COVID-19 situation we face. And we believe that the mechanisms are already in place, but anticipating proactive leadership to help make ends meet. The International Federation of Red Cross and Red Crescent stands ready to provide support to small island development states in international disaster response law, and we ensure sustainability of our respective disaster risk management system to help us all respond more effectively to the impacts of future disasters on our vulnerable population and environment. Thank you very much.
Thank you so much, Tala, for sharing the inspiring work of the Samoa Red Cross Society, especially the good practices and future lessons for coordination. And thank you to all of our speakers for taking the time to be with us today and sharing these important perspectives on how to develop a more integrated approach to public health and emergencies and to better address the needs of people impacted by disasters. You've given us a lot to think about in terms of how, where, and why law and policy for disasters and public health emergencies can work better together. So we have now about 10 minutes for questions, and my lovely colleagues behind the scenes have been collecting your questions, and we can address them now. So, and while we do, if you have any more, please do pop them into the chat box. It's not too late. So our first question is, could a common platform guided by mutually agreed business laws during disasters within specific regions be a way forward for future response? And I would like to perhaps pass this one first to Dr. Sanjay Srivastava, if you would like to take it.
Actually, I'm sorry, I was given two questions and I could able to complete only one question in my first intervention. I hope my second question will able to respond partly the question that you raised to me just now. This is on anticipatory action. I would like to share with colleagues that in disaster risk management, there is one action which has been a game-changing impact is anticipatory action. Early warning system for tropical cyclone, for floods, for drought, and nowadays heat waves. Whether this anticipatory action can be used also for public health emergency, I think this is one of the area where many of the new initiatives have been taken up. Let me cite the example what we have done in UN scale. What we have done is there is a global framework for climate services. You predict a season, sub-season, short-term, medium-term weather and climate events with certain level of confidence. So most of our predictions are in a particular sector. The sector could be a flood, drought, heat waves. But then the framework says your predictions could encompass many sectors, including health, water, energy, food, and then of course disaster management, extreme event. We could able to develop the prototype pilots using climate health services and demonstrated this to the stakeholders who deals with the extreme climate early warning system events. The specific example is one FOCRA. FOCRA is called Forum on Regional Climate Monitoring Assessment Predictions for Asia. This is the all the early warning system agencies of the Asia. We could able to make use of the ASEAN monsoon forecast from June to September, and there if you convert this monsoon outlook or a seasonal outlook to impact outlook, and then you include health into it, there are risk hotspots where there is a disaster, there is a public health related emergency, which exist in many parts of the region. So if there are high rainfall in those events or low rainfall in those events, or there are heat waves in those events, there is a potential outbreak of public health emergency, and you know this quite well in advance. So it's an opportunity to facilitate anticipatory actions. We took it from regional to sub-regional, South Asia Climate Outlook Forum, SASCOF, and then to extreme weather event prediction of tropical cyclone through escape WMO typhoon committees. So this is one area where anticipatory action in public health emergency, while there are a lot of opportunity to scale it up and make it a mainstream event addressing public health emergency through anticipatory action, the efforts that we are making is a important step in this direction, and this is also one of the key elements of the Bangkok Principle. So thank you very much, Sharaf. I hope I could able to respond part of the questions which my colleagues have asked us. Right, thank you.
Thank you so much for that really comprehensive answer. Our next question is from one of our participants. She writes, more broadly, in health, disaster management, and response, women are often treated as victims in need of assistance and unable to help themselves. While there is some truth in that approach, as patriarchy continues to be entrenched in many societies in Asia, this does little to empower them. What then can we as a civil society organization do to encourage women to be active and empowered agents in the revitalization of local communities? And can you cite a case study of policy or projects promoting women's empowerment in the context of societal response in the case of health emergency that can be held up as a model to countries in the Asia Pacific? Great question. Perhaps could I ask Ms. Tala, would you be interested to answer this question, please?
Women needs to be involved in a lot of community programs, especially throughout the disaster risk management program, which involves a lot of preparedness and up to when disasters happen. There's roles and responsibilities that we can engage and empower women in the communities to be involved in. And a lot is to do with hygiene promotion, in their own respective communities, in their families, their households, where they can assist and help not only the household, but the community as a whole. And I think this also can be very much effective depending on the context of how women in respective communities behave and are respected. In Samoa, with all that we do, we have to make sure there's a gender balance. We have to make sure women are involved, because these are the very people who deal with situations at home, who look after their children, their elderlies. And we used to refer to them as the most vulnerable groups, because in disasters, they will be dealing with the elderlies, with their children, and even with their families. And we have to ensure that they are well trained, on top of the roles that they play in their respective communities and their respective homes, so that when disasters strike, they will be multi-skilled, to further assist in the response to the disasters. We have been working a lot with UN Women, talking about case studies. UN Women, has been doing a lot of good work, especially engaging women who have been involved in gender-based violence and all of that. And I know that there is available case studies out there, for our colleague who has asked for support, to turn to looking at how UN Women and even Federation, a lot of studies has been done on gender-based violence and all of these that are affecting women, especially in disasters. Yeah, thank you.
Thank you so much for taking that question, Tala, especially as you are really one of the major role models for women's empowerment in the Red Cross, Red Crescent movement and in the Asia Pacific. And I think you cited a lot of really important points in how we include women in this important work. So we're just on time now. It's 1:45 here in Bangkok. So thank you everyone for joining us today. And I know there were a couple of other questions that were added to the chat box. Your questions will not be forgotten. You can certainly reach out to the disaster law team to get those questions answered. So before we end, I would like to pass it back to Catherine Clarkson from the IFRC for our closing remarks.
Thank you, Ranjani, and thank you to all the panelists that have given your remarks today. And on behalf of the co-hosts, IFRC, together with Ministry of Foreign Affairs of the Kingdom of Thailand, just to thank all of you that have taken the time to participate in this side event today, and to encourage you all that the conversation doesn't stop here. I know there are a number of questions that we didn't get time to get to, but yeah, I hope that they can still be answered at some point, and you can still connect with each other to help progress this important topic. I just had a couple of key points to summarize in closing. The first is to reiterate what I think all the speakers said around, let's not lose the opportunity of the COVID-19 pandemic to fresh in our minds, to be able to encourage and support with law and policy change when it comes to public health laws. And I think Dr. Genevieve highlighted also very clearly that it's not just perhaps one law. There are many laws that were touched on in relation to response, public health response under the COVID-19 pandemic. There is an opportunity coming up later in the year in September, the Asia Pacific Ministerial Conference for Disaster Risk Reduction, that will be hosted by Australia in September. Of course, at a ministerial level for a number of commitments related to progressing on this topic, but let's not either wait until then to be able to take action where possible to continue to strengthen the laws. And thirdly, I think as the speaker from Ministry of Health of Thailand, Dr. Alisa Yanason, highlighted that it's an all of stakeholder approach, I think in that example that you gave from Thailand. And IFRC, in our research that we're holding at the moment with the ASEAN Secretariat, we will be looking forward to engaging with all stakeholders as part of the consultation of that research, and the results of the research will lead to, likely to lead to ASEAN-specific guidance on health and disaster law. So hope that all of the people here today, you're able to feed into that important piece of work as well. I also wanted to highlight that IFRC has a global guidance coming out. We launched in July, but I believe it's already on our website. And I'll ask Hannah or someone if you can put in the chat box there the link to the website related to that publication, which is a guidance on public health and disaster laws. So just in closing, to thank you all again for joining today. Thank the panelists for your remarks and for working in collaboration with IFRC and the Ministry of Foreign Affairs of the Kingdom of Thailand, and on this issue, and particularly for the Ministry of Foreign Affairs of the Kingdom of Thailand. We would like to continue to work with you to help promote the Sendai frameworks, Bangkok principles, and really improve and strengthen public health laws for better disaster management and support to people in Asia Pacific. Thanks again, everybody, and we'll close it here. Bye for now.